Okay. A group of medical geneticists hypothesized that epidermal growth factor (EGF) could induce colorectal cancer. EGF could induce colorectal cancer cells to undergo epithelial mesenchymal transition, thereby enhancing their ability to invade and migrate. The group wants to study the relationship between EGF gene polymorphism and colorectal cancer. It plans to determine EGF A61G polymorphism by using PCR restriction fragment length polymorphism method in 249 patients diagnosed with colorectal cancer and in 261 patients without diagnosis of the colorectal cancer. Which of the following is the most appropriate null hypothesis for this study? Exposure. Is it cohort study?
You think it's cohort? Okay, so what would be the answer?
Relative risk, and as the most appropriate null hypothesis, then it is equal to it is not equal to 1. Okay, relative risk is not equal to 1.
What are they asking you?
First I need to find out which sort of study, and then I need to say that if it is case control then odds ratio, and if it is cohort then relative risk, and
Hmm.
then finally the third one, is this rejects the null hypothesis or is it accept the null hypothesis?
What are they asking you about the null hypothesis? They don't asking you to check if you have to reject or accept. No, they are asking you once you find out you're right, you have to find out the study design, case control, or blah blah blah. Then you have to find out the measure of association, odds ratio, right? Yes, and then they're saying once you find the measure of association, relative risk, and odds ratio, which one corresponds, which of these sentences or whatever corresponds to the null hypothesis. So you already know that null hypothesis for odds ratio and whatever means that the result is not statistically significant, right?
Yes,
Okay, so if it's not statistically significant, does it include or excludes one?
it includes 1.
It includes one. So we're trying to find which of these statements equals the new hypothesis. So do you think it will be the one that includes one or rejects one?
Includes 1.
Okay,
Then it is
rejects
odds
one.
ratio equal to 1.
Okay, so you think it's which one? Sorry. Okay, I
C.
couldn't see. Okay. So you think this is case control. You don't think it's cohort.
No, I think that uh, they are talking
So,
about
mhm.
uh, case control. That means disease versus non-disease, isn't it? So
Okay.
they are with the patient with colorectal cancer and without the colorectal cancer. like
Okay.
249 diagnosed with colorectal cancer and 261 without colorectal. So disease versus non-disease.
Okay. Okay. Let's check. Oh, what happened? Yeah, it's C. Okay. So I guess you got this. You can read the occupational objective, but I think you got this. This one.
So odds ratio is a measure used in case control study. It quantifies the relationship and exposure and disease. Its null value. Its null value is always one.
Okay.
In the study design that chart, like if we
Uh,
found outcome to exposure, that one.
mhm.
So this is outcome. Colorectal cancer is the outcome, isn't it?
Okay. Mm-hmm. Mm-hmm.
And outcome, we will now look for the exposure.
Will you? What do you mean they would that you would look? Oh, you they are look. Okay. Yeah, they will look for the exposure. Uh huh.
So
I mean,
in here
mhm.
there is exposure also, there is outcome also. So which
Mhm.
one is first and which one is the second? Like how these things should be thought. You got my point.
No, I don't get what you're asking.
Like in here there is exposure also, in here there is outcome also. So why I will think that it is outcome to exposure, why I will not think that it is exposure to outcome?
Because if it was outcome to exposure, they will give you um, people with the EGF gene. Okay, you already determined. We know that the outcome is the colorectal
Colorectal cancer,
cancer, and
yes.
the exposure is the is EGF gene.
EGF gene,
If the
yes.
patient has the EGF gene, okay. If it was cohort, so if it was, they will give you people with EGFF gene and people with no EPS, no EGF gene. And now we follow them to see if they develop colorectal cancer. You see, they give you
Yes,
exposure positive and exposure negative, and we follow them for the same outcome. But here they are giving you outcome positive colorectal cancer and outcome negative, no colorectal cancer. And then we're checking for the same exposure if they have EGF. We are not checking for the ones that don't have, it's not two exposures, it's just one. We're not checking for the ones that don't have it. We're checking for the ones, we're just checking for ECF, EGF, whatever for the autism. Does it
yes,
make sense?
yes, it makes
Yeah,
sense.
yeah. So they will give you, if it is cohort, they will give you both exposure. Yes, exposed to smoking, not exposed to smoking. Let's follow them and see if they develop cancer. But case control, they will say, okay, we have people with cancer, people with no cancer. Let's see if they ever smoke. You see, one is two, what the other one is which. Okay, I don't know. I'm not going to confuse you, but you get what I'm saying.
Yes, I'm
Okay, next.
okay. A new test is devised to measure the serum level of a specific protein. A sample of blood is taken from a patient. The new test is performed three times, 162, 186, 1 247, using the traditional reference test. Consider the gold standard. The patient's serum protein level is determined 184, a measurement within the 5%. The reference test value is considered accurate. Based on these results, the test most likely has which of the following characteristics? It is low precision, low accuracy.
Oh, this what you think is this one?
Yes,
Precision.
because low precision is closure. Like precision will happen if it is 162, 164, 165, or 166. Like uh, closure, and
And you,
if it hits the bullseye, then it is highly accurate.
so you write this low precision, low accuracy. Can you read the explanation, please?
Yes, obviously. A measurement tool should be both precise and accurate to be useful in the clinical setting. Precision and accuracy are defined as follows. Precision, reliability, is the ability of a test to reproduce identical or similar results with repeat measurements. Two bottom figures. Accuracy, validity, is the ability of a test to measure what is supposed to measure. For a test to be accurate, its results should be equivalent to the results obtained with gold standard based conventional tests available on the same individual. Two right figures. A precise test gives similar or very close result on repeat measurements. In this example, repeat measurements of the same sample yielded a different result, 160 to 186 to 47. Therefore, the new test has low precision. The value given by the reference test for the patient 184 with accurate values considered to be those within the 5% reference value. Lower cutoff 184 minus 184 into 0.05 174. Upper cutoff 184 plus 184 into 0.05193. Only one repeat measurement, 186, is within 5% reference value. Therefore, a new test has low accuracy. Okay.
Okay, perfect. Next.
Yes. A group of endocrinologists conducted a randomized control trial to compare the of capsaicin versus turpentine oil for topical treatment of painful diabetic neuropathy. Patients were randomly assigned to topical application of either capsaicin group 1 or commercially available turpentine oil group B over a painful site on their feet. The primary outcome was significant reduction in pain on visual analog score and treatment efficacy defined as 3 or more than 3-point reduction on VAS visual analog scale. An excerpt of the study results in shown below. Group A in 141, Group B in 139. Which of the following tests would be the most appropriate to determine whether there is statistically significant difference whether there is statistically a significant difference in treatment efficacy between two groups? Is it chi-square or is it t-test? It doesn't look like
Okay.
t-test.
Okay, so you want to eliminate all the other ones. You think it's between chi-square and t-test.
Yes,
Okay.
I think that t-test actually like blood pressure between the two groups people like that, and in here they actually
Mm-hmm.
categorized the,
Okay.
so it is, I think it is chi-square. Okay.
Okay. I think it's that too. Let's check. It's chi-square. Okay. Go
Okay.
ahead.
A chi-square determines whether the distribution of categorical outcome, categorical versus qualitative dependent variable, is different across two or more than two independent groups. Categorical or qualitative independent variable. In this study, the categorical dependent variable is the treatment efficacy with two categories: efficacious, defined as 3 or more than 3-point reduction on the visual analog score for pain, and not efficacious. The independent groups are Group A capsaicin and Group B turpentine oil. A chi-square test will determine whether a statistically significant difference whether a statistically significant mm, a chi-square is determined as whether a statistically significant difference in efficacy exists between two groups. The, the test only applies if the groups are independent where observation in one sample and are unrelated to observation in another sample. Okay.
Next,
Yes.
we got it. Okay. Okay, I guess this one is, I guess you have to answer here based on this. Is it a positive or a negative correlation?
Isn't it negative correlation? Slope is going down and positive will go from 0 to upwards.
Mm.
Am I
Oh,
right?
sorry, yes, positive or negative? Sorry, I didn't hear you.
As the slopes is going down, isn't it negative? If it,
Okay, so you
yes,
think it's negative.
thinking,
Let's, and this is going like this, and this is going. Yeah, I guess it's negative. I think. And let me check. Okay, they did not give me the answer on that one, but I think it's negative too, because this one, negative and positive just mean one variable is going down while the other one is going up, or vice versa. So they are both not going in the same direction. So yeah, you're right. Because here, if we follow this one is going up. So this one is increasing, but this one is decreasing. Do you see it?
yes. Can you say it
Okay.
again?
Uh, like if you look at the line is going from here
Down,
to here, right?
yes,
So hours of sleep is going up,
yes.
and the irritability score is going down. Does it make sense?
So we will say positive, negative based on score.
No, no. Based on if one variable is the x one, the
Okay,
hours of sleep,
one
and the
is
other
going
variable
down and another is going up.
is
That
going
is
up, negative. So both are going in different directions. One
okay.
is going up, the other one is going down. One is going down, the other one is going up. If they are both going in the same direction, let's say this was like this,
Yes,
okay?
yes.
Here, the hours of sleep, is it going up or down?
Our sleep is going up and inability score is going up too. So it is positive correlation.
Perfect, you got it. That's it. That's all.
And if everything is scattered, then it is no correlation. The dot dots are closer to our line, isn't it?
So what does that mean? It's closer
Uh,
to our line.
Look here. Can you see my screen now?
Oh, sorry. No, I cannot see it
Now.
yet. No. Okay, now.
So this is Pearson correlation coefficient.
Mhm.
So you have told me that if
Mhm.
uh, if it is going down, like one is
Mhm.
going up and another is
Mhm.
going down, that it is negative. this one,
Mm-hmm.
and
Mm-hmm.
it is strong or it is weak based on uh, the arrow is going the the look at the arrow direction and look at the
Okay.
dots. If dots is
Okay.
closer to arrow, then it is strongly correlated. If dot is not going to the arrow direction, like if it is slightly scattered, then it is weakly negative correlation. And look here, this is no correlation.
So here in our example on the biostat thingy, would that be negative? We already know it's negative. So will it be negative 0.04 or negative 0.08?
It would be negative 0.8, this one.
Okay, perfect. Got it.
Okay. Okay, now you can share the screen.
Okay, that I did it. I checked. Next.
Yes. Okay. A 35-year-old woman comes to the office due to a self-palpated breast mass. After appropriate workup, as image-guided core biopsy of the mass is performed, the results of the core biopsy return as negative for malignancy. However, the results showed both atypical ductal hyperplasia and atypical lobular hyperplasia. The patient understands that having ADH and ALH significantly increase the risk of breast cancer and is concerned. She asks how likely it is for women with ADH and ALH who have negative biopsy truly cancer free. Which of the following measures best address this patient's question? Negative biopsy truly be cancer free. So they are looking for true negative.
Uh, Not mm,
These things actually
I know that's
bangs
why we
my mind.
like those the yeah, this is the same one as the where I was telling you X given Y.
Yes.
The line. The line is the given and then what the Y. So given what are they giving you? Given the page the woman is ADH whatever and LAH who negative given a negative biopsy,
Yes.
so given Y,
Yes.
which is a negative biopsy, so a negative test. Like what is that? Given a negative
Okay,
test.
1 second. I am calling one.
Can you hear me?
Yes, I can hear you. Okay. What you are talking something.
What was I saying? Let me see. Um, yeah, the thing that I was showing you yesterday from the video, given a negative test, negative biopsy, so biopsy will go at the bottom. What is the likelihood that she's truly cancer free? So negative. What is the possibility that she doesn't have the disease, cancer free? So cancer free will go at the top. And we know from the definition, negative disease,
And negative,
over all
so it is
people with
negative
negative
predictive
test.
value.
You
NP.
got it. So you just have to know how to position what they're giving you into the thing.
So
They usually calculate
first,
that they're going
I need to think like if we found this type of option that X and Y. Okay.
to. Mm-hmm.
So we have found the line that the negative negative biopsy is truly cancer free. So they have so so we are looking for test negative and also the disease negative, isn't it? The Y one is the test and the X is the disease.
No, not always. No, 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 no. Don't, it's not. It's not always like that. No, no, no. You are looking for the last sentence that what they are asking you. This is
Okay.
not always test. This is not always disease. This can be test. This can be this. That's why you're reading the last sentence they are giving you. They're
Okay.
saying that the woman is asking um, for women who have ADH and LDH and who have a negative biopsy. So they gave you the test first. That's why you put it at the bottom. How is it that she's truly cancer free? So the first one they give you, you put it at the bottom. And then how is it that she's truly cancer free? You put it disease at the top. But she could have said, oh, how is it likely that if I'm disease free, let's say she had said, the woman is asking you, how is it that likely that if I'm disease free, so disease will go, negative disease will go at the bottom, that my test will come back negative. So test will go at the top. So you have to look at the question they're asking you. So here it won't be
So first thing
negative predictive value.
will come to the last.
Yes, the first thing they're giving you, that's what comes in the denominator in the bottom. And the second thing they're asking you, that's what comes to the top. So here, what will be the measure that they're asking you on this one? Negative test of a negative disease.
Like, can you just tell me again? Like, we are reading the
Oh,
last line. The last line says the negative biopsy. So test. So test should be below, and like
okay.
test should be in the denominator, like denominator,
Okay. Um,
and
um,
the cancer, the disease should be in the numerator. That's how
okay.
we think. That's how we
Mm,
should proceed.
because of this question. Because of this
Oh,
question.
okay.
Yeah, because
So
this is the question they give.
if question changes like the
Uh-huh.
first thing, I need to remember first thing comes last. Like the first thing will go downwards, and the
Uh-huh.
next thing is go upwards. Then it is easier,
Okay.
isn't it?
Okay. Yes. 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 So here it they were telling you, okay, the first thing that goes to the denominator, you just say first thing goes at the bottom. They say, okay, cancer free goes at the bottom. And then negative biopsy goes at the top. What will be the measure that you're using here? What will be the answer from here?
Okay. Sorry. Again,
Okay.
if okay,
Um, uh-huh. So how did you come up with this is negative predictive value?
uh, I come out
How
with
did you
this
know?
negative predictive value because if test is negative and disease is also negative, both is negative, then it is negative predictive value. According to that thing, like that you have taught me last
Okay.
yesterday. In
Okay.
there, if
So
both
here,
of yes,
mhm. So here then what would it be according to what I told you yesterday?
this one,
Uh-huh, this one, sorry.
if the test
Here
is
you say,
yes,
uh-huh. Here you say test is negative, disease is negative, so it's negative predictive value. So how, what would it be on this one?
if test is negative and disease is negative, it is negative. So it is specificity.
Perfect. You got it. Okay. Okay, let's look at the answer. You're right, it's negative predictive value. Look, you can have predestination.
So which one is upwards, which one is downwards? How you remember things?
What do you mean?
Like uh, if test, this is the switch, just the switch. The test is upwards and disease is the
Mm-hmm.
downwards. So that's why it is specific, isn't it?
Mm-hmm. 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 Mm-hmm.
Okay. Okay. In sensitivity and specificity test will be numerator.
Test it
Okay.
up. Mm-hmm. Mm-hmm.
Okay.
That's what I
Plenty
was.
of things.
Yeah, yeah. That's what I was trying to explain yesterday. That yeah. I guess when you see it on the YouTube, he writes a lot, but that's what he's trying to say. If one test is up, the other one is down, then you know it's a specificity or sensitivity. If the disease is up and then whatever, then you know it's negative predictive and positive predictive. That you see, it's just the switch that switches the, yeah, the measure that you're using.
Okay.
Yeah, read the explanation.
Yes. The predictive value of a test is the probability that the test result, positive or negative, reflects the true disease status, that is, disease, no disease. Positive and negative predictive value are defined as follows. Positive predictive value determines how likely is that a patient with positive test results truly has the disease. Negative predictive value determines how likely is that a patient with negative test truly does not have the disease. Positive and negative predictive value are directly positive and negative predictive value are directly related to pretest probability of a disease. Okay, can you give me 1 minute? Somebody came.
Yeah,
Okay.
yeah. I think you were reading. I don't remember. I think it was. Did you finish reading this? Was
N-
it the
n-
next
No, no, I
question?
haven't finished
Oh,
reading
okay.
this. Let's read the explanation. Okay. The predictive value. The predictive value of a test is the probability that the probability that the result, positive, negative, reflects the true disease status. That is disease, no disease. Positive and negative predictive value are defined as positive predictive value determines how likely it is that a patient with positive test truly has the disease. Positive predictive value determines how likely it is that the patient has a positive test result truly has the disease. And negative predictive value determines how likely is that the patient has negative test result truly does not have the disease. Okay. Positive and negative predictive value are directly related to the pretest probability of the disease, often estimated by the disease prevalence in a given population, assuming of other factors remain constant. Positive predictive value increases with prevalence, negative predictive value increases positive predictive value increasing prevalence, negative predictive value uh, decreases with increasing prevalence. PPV, okay. In
Got
this,
it?
yes, the PPV is in like a prevalence.
Mm-hmm.
PPV is prevalence equal to like proportional to ppv and inversely proportional to npv. That's the thing.
Okay.
Okay. In this
Next.
case, yes,
Oh,
in this case a woman receives a negative breast biopsy result. Based on biopsy findings, has begun she has benign breast disease. She has benign breast disease, a typical doctrine, and lobular hypoplasia that increases the risk for breast cancer. She asked about the likelihood that the woman with the same risk factor, a similar pretest probability of the disease, and who have the negative biopsy result are truly cancer free. Therefore, the measure that addresses the patient's question is negative predictability. In women with higher risk factor profile, higher pretest probability of disease, the predictive value The negative biopsy results may be lower. Okay, next,
Mhm.
okay. A study compared the efficacy of postpartum oral cephalexin in combination with metronidazole versus placebo to decrease the surgical site infection rates among women with obesity who have already received standard preoperative antimicrobial prophylaxis and undergone cesarean delivery. The absolute risk reduction between the cephalexin metronidazole group and the placebo group is 10%. In the placebo group, the surgical site of infection is 16%. In cephalexin metronidazole group, there are 12 patients with surgical site infection. Based on this information, which of the following is the approximate number of the patient in the cephalexin metronidazole group? They are looking for the N.
Okay.
Uh, the ARR, absolute risk reduction, between the metronidazole placebo is 10%. ARR is 10. In the placebo, 6%. Six, 6. Should we start like we need like 16% minus 10% equal to 6%? We need to find out this first.
Mm, This question, I have no idea because I don't know how you can find. Is there a formula that you want to use that you can use to
Like
get
12
from?
patient with surgical site infection. So 12,
Oh, look at that formula. There is a formula.
yes, there is a formula. Like then we can find out the number in.
Uh, so if you do here, we are given, they're asking us for this, they are giving us this, and I'm guessing we can find this. I forgot how you find this. Let's see. Oh, never mind. I found this. So RRR would be then over by the 100 and the 60.
Is the answer is 200?
You think it's 200? Okay, let me see. Let
Well,
me find mine really quick.
I don't know how
Uh,
I find it out.
you don't know how you found it out?
No,
10, 360, times 100. Oh, never mind. Don't follow me. I think it's 160, but I'm definitely not.
let's see. Maybe you are right.
No, probably not right. Uh, it's 200. You're right. Okay. Did you find it?
Okay, let's see the explanation.
Okay. Hello?
Yes, yes.
Oh,
Okay, now, okay, I'm seeing the explanation. Okay, they actually, they have done, they found out the absolute risk reduction. In here, absolute risk reduction uh, is given. It is ARR is 0.10. They have given the rate control, but they haven't given the rate treatment. So we need to find out the rate treatment. You got it?
yeah, yeah, I'm with you. We are reading
Yes,
here, right?
yes. So 0.06. Then rate treatment equal to number of infection divided by n. So we know that 12 patient has what can I say, surgical site infection. So 12 divided by 0.06 and n equal to 200.
Okay. Probably not gonna remember that during the exam, but okay. Next.
We need to find it out. Remember. What I have done, like
hmm Is
I found out the difference, like uh, in here cephalexin metronidazole group is 10 and placebo group is 6. So so there is 6%, isn't it? The difference is 6%.
wait, why? One is 10, the other one is 6. How is the difference 6?
Like 16 minus 10 equal to 6%. Placebo
6.
control 16 and
Um,
metronidazole group is 10%. So there is a difference called 6% difference, isn't it?
but why do you do? Okay, this is placebo group, and this is the absolute risk reduction 10%. It's not metronidazole.
So
It's the.
placebo minus the total equal to the cephalexin metronidazole group.
Okay.
So if 6% patient, like 6%,
Mm-hmm,
then I found out that in the
mm-hmm,
cephalexin metronidazole group, 12 patient
mm-hmm,
with surgical site infection, isn't it?
mm-hmm, mm-hmm,
So the 6%, I made the 6%, it is at 100. So 12 divided by 6 percent, like 12 by 6 into 100, that means 200. Very complicated way, I know, but I try to do something that actually fits with the answer. You got my point. So I try to calculate here and there and try to fit something which actually fits with the answer. Then how I found it. I know it is not the
okay.
actual way.
Okay, as long as we were able to get the answer, that's already
Yes,
good. Yeah. Okay. Okay. Next.
yes. A study conducted in the state of Michigan evaluated the safety and the effectiveness of reduced dose apixaban 2.5 milligram twice daily compared to standard dose apixaban 5 milligram apixaban 5 milligram twice daily for prevention of thromboembolism in patients with non-valvular atrial fibrillation. Patient with non-valvular atrial fibrillation who recently started taking apixaban were followed for 24 months. Apixaban doses were selected at the discretion of treatment physicians. Primary outcomes were hemorrhagic and thromboembolic events. Study results summarized incidence rate and outcomes. Incidence rate, major hemorrhage. mm, Okay, p-value is clinically significant. Researchers concluded that the reduced dose group showed higher incidence rate of the thromboembolic and major hemorrhagic events than the standard dose group. Which of the following raises the most concern regarding this conclusion? No. I found an answer. I don't know. I
What's the
think that
answer?
the study compared the reduced dose and the standard dose without a placebo. Is
You think that's the answer? Okay. I think it's
this is one thought we need to keep in our mind, isn't it? Okay, yes. Say it most concerned. Okay.
okay. But you got the you understood the question. What they I think this is pretty clear. You understood what they're asking you, right? You understand the question. Yeah.
No, you tell me. Maybe I
No,
am missing something.
you tell me what are they asking you in your own words.
Yes,
Mhm.
they they actually give what can I say, direct oral anticoagulant in a low dose, in high dose, and they actually try to find out what is the outcome, what is the complication happening, like major hemorrhage or thromboembolism. These are the complication can happen due to use of direct oral anticoagulant, and they are trying to find what is the most concerning factor.
What does
Maybe I
that
am
mean? What
missing
is the
something.
no?
You
May
tell you
yeah.
tell me. I told you that I might miss something.
No, because you are telling me the question, but you are repeating the whole thing. But I'm just asking you this specific question: which of the following raises the most concern regarding this conclusion? What does that mean? What are they? Because this is the question. All of
Yes,
these
yes,
you
yes.
said is the main question.
Most
So
concerned regarding this, like major hemorrhage is the most concern.
don't you think they're trying to ask you what is wrong with this study?
Okay, what's
Just simplify it in your head. Simplify it. Don't repeat it. Simplify it in your head. They're trying to ask me what's wrong with this
yes,
study. What did the researchers do wrong? What the investigator what is wrong? Okay, so you think it's D as in dog.
yes.
Okay. Do you want to eliminate any other? You just sure it's okay. I think it's C. Let's
Okay,
see. Let's see. It's C. Can you tell me? Were you sure that it's not A and B? Can I eliminate? Can you do the elimination? Can you eliminate why it's on the other ones?
The B option B, the follow-up period is insufficient to observe the enough outcome. Follow-up period is almost like 2 years, so it is enough to see the outcome.
Okay, okay, perfect.
Okay, and the option A, the external validity of the study is low due to geographical. I don't think so. The external validity is low.
Okay.
I forgot what is external validity and what is internal validity. Like when they say about external validity, what will I think?
If you can generalize it to the outside population, to all the other populations, if you can generalize the conclusion to other populations outside of the one that you study. But they did it in Michigan. Michigan is a big state, so I think it should be fine. It's not. I don't think the standard validity is a problem. Michigan is like a big state, so it's fine. Why is it not? Yeah, I guess nah, that's fine. Okay, so we are between C and D. We know it's not A because they're asking you what is wrong, so they're not going to ask you what is wrong if there is nothing wrong. So we know it's not E, right?
Yeah, yes.
So we are between C and D. Okay, let's read. Why is it not D?
Wait 1 second. Mm, where I'm going? Okay. Uh, I scroll too much. Okay. Okay. Sorry. The study evaluated the safety and the effectiveness of a reduced dose apixaban compared to a standard dose apixaban 5 milligram twice daily for prevention of thromboembolism in patients with non-valvular atrial fibrillation. Patients with non-valvular atrial fibrillation who recently started taking apixaban were included in this study. Each patient received either the reduced dose of the standard a reduced dose or the standard dose at the discretion of the treating physician and was followed for 24 months. The discretion in selecting the dose suggests that the treatment reduced dose standard dose were not randomly assigned to patients. Non-random treatment assignment may lead to selection bias because patients may have unequal chance of receiving either treatment. In this study, some physicians may have preferentially assigned older patients with more health issues to receive reduced dose apixaban because they were worried about a greater risk of hemorrhage among these patients. This situation often leads to non-equivalent groups, which means that any effect of a treatment reduced dose might be result of the groups being different at the outset. Older patients more health issue rather than different at the end because of the treatment. Educational objective non-random treatment assignment may lead to selection bias because study participants may have unequal chance of receiving the treatment of interest.
Make sense?
Yes.
Okay, perfect. Next.
Okay. A randomized controlled trial was conducted. A randomized controlled trial was conducted to investigate the effect of IV lidocaine or hemodynamic response to endotracheal intubation during induction of anesthesia using a novel mm, using a novel strong opioid. 90% or 90 patients age 18 to 65 were recruited. Induction of anesthesia were initiated using a standard protocol. The patients were then randomized to three groups. Group L1 received 1 milligram per kg of lidocaine. Group L1.5 received 1.5 milligram per kg of lidocaine, and Group S received a standardized volume of saline. Baseline analysis compared the distribution of sex, age, body mass among treatment groups. The plots below show the distribution of body mass in treatment group. Group A, Group L1. An analysis of the variance ANOVA was conducted to compare the mean body mass among groups and yielded p-value 0.022. If a significance of alpha is 0.01 is considered, which of the following statement is true? Okay. Which one is the answer?
You tell me, what are they asking you? Wait, I think it's pretty clear what they're asking you. Yeah, what statement is true?
Yes,
So
which
tell me.
treatment is true? P-value is clinically significant. Uh, Alpha. I don't know.
Can you eliminate something?
No, nothing.
Nothing? Okay. Okay. Let me take you back to, let me see that one. Where was that one? Where was that one? Where was that one? Was it day two? Was it day two? I guess it was day
Day
two.
two.
Day two. It was a, you need to watch those YouTube videos. I feel like they really help. What's that one? This
Yes.
this one. Mm-hmm. Can you answer using this space? The
Alpha.
green one.
Mm, no, they have said that if a signal alpha is considered significance of alpha like type 1 error.
Okay. Now can you delete some?
Mm, difference mean body mass and groups cannot be measured using ANOVA. False.
False. Okay. Pick it up.
And if is also false, there is not enough information to determine whether the
Okay.
signal. Okay.
Mhm.
If
So here they are giving you,
there is a
you know,
significant, yes,
go ahead, go ahead, go ahead.
it is clinically significant, so no difference is ruled out like D and E.
Okay, you think we have to rule out D and E.
Yes,
Okay. So what do you think is the so remember on that, that's why I pulled this up.
yes,
Remember here he told us that type 1 error, um, well, she said alpha. Alpha is type 1 error.
yes,
Alpha is set by the researchers. It's the point zero 0.05 that you know, and I know that you know. The point zero
ye-
0.05 that you know that usually if it's less than point zero 0.05 is statistically significant. So
yes,
type 1 error usually doesn't change because it's already set by the researchers. It's said everybody knows it's point zero 0.05. The only time it changes is if the researcher for this study himself says, you know what, I don't want to use point zero 0.05. I want to use point zero 0.04. I want to use point zero 0.10, point zero 0.01, or I want to use point zero 0.02. It's when the researcher himself for that specific study that he's doing, he says he sets another alpha. So this researcher in our question,
they said 0.01.
they set the alpha to 0.01. So you cannot use the 0.05 here. He gave you the alpha that he wants. It's not zero point zero 0.05. But you're still using the same thing, the same logic. If it's higher than zero point zero 0.05, then it's not statistically significant. If it's lower than the point 0, sorry, if it's higher than zero point zero 0.01, then it's not statistically significant. If it's lower than zero point zero 0.01, then it's statistically significant. You still use the same logic. You just not using the zero point zero 0.05 because he wants for this specific experiment. He says I don't want to use zero point zero 0.05. I want to use zero point zero 0.01. Does it
Okay.
make sense?
Yeah.
Okay, so what would be the answer now that it makes sense?
Mm, there's is it D?
D as in dog.
Yes.
Okay, so there is no significant difference in mean body mass among groups because p value is less than alpha. So you mean this p value is less than alpha. So 0.02 is less than 0.01. Is this true?
False. No. So zero. Then E. There is no significant difference in the mean body mass among if p value is 0 more than point alpha. P value is 0.02, which is more than the 0.01.
You think it's E?
Yes.
Do you understand why it's E?
We are comparing the p value with the alpha. And alpha in here, it is not like normally as it is 0.05, but as the researcher changes it into 0.01. So I don't know how I compare it. Like, what is the catch here?
Okay, so if alpha, let's leave this one. If
Yes.
alpha K was
Hmm.
0.05, like the same one that you always know,
Yes.
so would that be statistically significant or not? Would this p-value be statistically significant or not?
Hmm. Yes, p-value is statistically significant then.
Why?
0.02 2 is less than 0.05.
Perfect. It's statistically significant because that p-value is less than 0.05. So perfect, you got that part. Oh my goodness, that's my thing. Yes. Okay, so now we're changing the alpha. We're doing 0.01. So now is this p-value statistically significant or not?
No, it's not statistically significant
Why?
because 0.02 does not
Mm-hmm.
fall into 0.01.
What does that mean does not fall into? Like,
Like 0.01 is higher. Sorry, 0.02 is higher. Uh, Sorry, 0.02 is lower than 0. Oh, what can
huh?
it is opposite, just opposite.
Okay.
Yes,
So does that make sense now?
yes,
Okay. Okay. So it's the same thing that the same logic that you're using here is the same one. It's just you're changing this to this, and now uh, the point zero 0.02 becomes lower instead of higher. It's the same
yes.
thing. That same logic. Okay. Okay. You read the sorry the answer.
Explanation.
Definition.
Okay. If p-value if p-value more than significance level, if p-value more than the significance of alpha, there is no significant difference in groups. Data do not provide statistical evidence that HA is true. If p-value is less than the significance level, there is a significant difference in at least one grouping. Data provide statistical evidence that HA is true. In this study, alpha 0.01 and the ANOVA yielded the p-value 0.02. There is no significant difference in the mean body mass among groups because p-value in here is more than the alpha significance level. This indicates there is no sufficient evidence to reject H naught.
Makes
Okay.
sense.
Yes.
Perfect. We are done with day 3. I'm gonna take a quick break before
Yes.
we start. For okay.
Yes. Yes.